Hello, I'm Dr. Elizabeth Kavaler of Total Urology Care of New York, and this is Total Urology Care on My Personal MD. Botox was FDA approved to treat frequency of urination, urgency, and urinary incontinence in 2011. Since then, hundreds of thousands of men and women have benefited from its use. There are two main kinds of urinary incontinence from which both men and women can suffer. The first is called stress urinary incontinence, in which there is an involuntary loss of urine during physical activity, such as walking, running, or jumping. The other type of incontinence is called urgency incontinence, which is where urine is lost when there is an urge to urinate, but the bathroom isn't close enough. Urgency incontinence is treated with exercise, medication, Botox, or an implantable nerve stimulator. Pelvic floor exercises should be instituted as the first effort in controlling urgency incontinence. If adequate control is not obtained after 6 weeks of diligent exercise therapy, medication would be the next step in treatment. 10 options are available, at least one of which is covered on each person's insurance policy. Different medications can be attempted before moving on to the next option. The potential side effects include dry mouth, constipation, and blurry vision. They are not common and often not bothersome, especially if the medication works. Botox is indicated if medication is not effective or the side effects of the medications are bothersome. Botox is injected into the bladder through a scope that is inserted through the urethra. Numbing medicine is instilled into the bladder approximately 15 minutes before the procedure is performed. 20 to 30 injections are delivered into the bladder muscle in about 10 minutes. After the procedure, the patient gets up, urinates, and leaves the office approximately 30 minutes after coming in. No anesthesia is necessary. It can be done in a surgical center if the patient wants sedation. It takes anywhere from 3 days to 2 weeks for the Botox to kick in. Once it starts to work, the results are dramatic. The goal is to be able to urinate no more than every 2 to 3 hours and to get up no more than once or twice a night. Many patients have even better results. Over 6 to 12 months, the Botox will wear off and the symptoms will recur. Regular injections can be performed with equally as desirable results. Botox can be injected into both men and women. Most insurance plans cover Botox injections. Both urologists and urogynecologists offer Botox in their practices. To learn more, subscribe to My Personal MD now, and be sure to check back for new videos each week.